Start. Today's lecture is about the androgen, which are commonly known as male sex hormones. So today we will discuss regarding the pharmacology of this hormone and the different used drugs or clinically used drugs in this domain. So the topic is pharmacology of male sex hormone, that is androgens. What we will discuss today is a brief summary what we will discuss today. Like for example, we'll talk about little about androgens, their synthesis, secretion, regulation, but the main focus is on pharmacological actions because we are discussing with the pharmacology background, pharmacokinetics, preparation, therapeutic uses. So the first part of the talk will be around for the androgens and their different uses in respect. The other part of the talk is anabolic steroids. Not much will be discussed, but 2 or 3 slides we will discuss regarding anabolic steroids because they are interlinked with androgens, so they are basically androgenic compounds. And then finally, which is more important, the anti-androgens. Anti-androgens, they have a very important clinical use. So they are used in different clinical conditions. So we will focus on 3 of this domain. We start with the androgen. What are androgens? Androgens are the substance which causes the development of secondary sex characters. Androgens are produced by the testes in males, and the main function of the testes in male is first to cause spermatogenesis, which is caused or done in the seminiferous tubules, and the second is androgenic hormones. So this is how these androgenic hormones are produced from the testes in male, because they are mainly the male hormones. So we will more discuss with this in the male background. Androgens could be natural, for example, from the testes. I just discussed it. Testosterone is produced from the Leydig cells, and it's usually produced in 5 to 12 milligrams daily. But the active form in our body for this testosterone is dihydrotestosterone, DHT we also abbreviate it as. And this is done by the help of an enzyme known as 5-alpha reductase. So the main player at the cellular level, although in the blood you would find out testosterone, but the main player at the cellular level is dihydrotestosterone. This is the active compound that goes intracellularly and does all functions. These are the natural androgens. We also have some quantity of androgens from adrenal cortex. This is dehydroepiandrosterone, androstenedione. They are weak androgens, or they are not much effective. Female also, we have also small quantity in the female from ovary and adrenals. So the main androgen in male is basically testosterone, and its active form is dihydrotestosterone. Synthetic androgens are now in the market, and once we know their uses, there are many legal uses, although there are also some illegal uses. But the legal use, we have also developed drugs that work as an androgen, like methyl testosterone, floxymisterone, and other propionate. This we will discuss, and we will discuss with the androgenic actions or androgenic uses. Okay, a little about testosterone. That testosterone is produced from the cholesterol. So the main precursor of testosterone in our body is cholesterol, and it is produced from the Leydig cells in the testes. And important thing that this hormone is active in the first trimester of the pregnancy, also in the later life, and then finally it comes in the puberty time period. This I have been already discussed that 5-alpha reductase is the enzyme that basically converts testosterone into dihydrotestosterone, DHT, and which is responsible for many of its function at the cellular level. Okay, it's cause prostate gland hypertrophy. All the secondary sexual characters are basically done with this DHT. The target for testosterone in the body is a single receptor, that is an androgen receptor. So androgen receptor, all these androgens bind to this receptor, which is known as androgen receptor. In the plasma, it may also bind to albumin, but in the plasma we have a separate protein for this that actually carries this hormone, and this is known as sex hormone binding globulin, SHBG. This is 98%, more than 90% of this hormone is actually transported via this protein. Androgen receptors are not only responsible for the secondary sexual character, means they are not only present in the reproductive tissue, but they are also present in the skeletal muscles, brain, and kidney. And this is why the skeletal muscle or the more mass production or masculine nature in the male is basically due to this hormone. And if this hormone is taken in a more quantity, the musculature can be increased, and this is why this can be used in many conditions, legal as well as illegal. That means that people use this to increase their mass of their skeletal mass. Okay, so first pass, it has a first high pass. It means that if you take testosterone orally in the drug form, so it has a very high first pass metabolism. So usually if we use it as a drug, we do not use it as orally. If this form is testosterone. Testosterone itself is not easily absorbed from the intestine, but the other derivatives of testosterone can be taken orally. Okay. The structure of testosterone of this androgen, all the androgen is basically is more of steroidal nature. So it's the typical steroid structure you can see, and they are the 19 carbons compound, and they have a steroidal structure. Testosterone itself in the body is regulated by other hormones. We know that we have a master gland, anti-pituitary gland, and this basically releases two hormones, luteinizing hormone and FSH. LH is basically give orders to Leydig cells of the testes, and then it produces the testosterone. Also, spermatogenesis is a part from the FSH. So, in the body, the function of this testosterone is dependent on luteinizing hormone, which is released from the. Why I am discussing it, although this is a part of the physiology, you would have been discussed, but we are just giving a repetition because we will discuss more few drugs which affects on LH secretion. So if you reduce this LH secretion, or LH is also take its instruction from GnRH, gonadotropin releasing hormone. So any of this luteinizing hormone or gonadotropin releasing hormone is inhibited, or the secretion is being increased, they affect on testosterone. So we will discuss the drugs that will affect on LH. So once LH is blocked, there will be no testosterone, and the condition can be reversed. Okay, so this is important that you know the upper centers, how this testosterone in body is. Also important part is that the testosterone is converted also estradiol by the enzyme known as aromatase, or it's an enzyme through which this estradiol is converted. Okay. How this androgen works? Androgen receptor are basically they belong to the nuclear receptor superfamily. Although you know that steroid also function with this nuclear receptor. They are slow in function, means you have a fast channel like ion channels, you have G protein coupled channels, you have discussed. These receptors, they are slow in activation, but their actions are prolonged. So this is the characteristic property of the nuclear receptor, of the DNA receptor. So they bind to the nuclear receptor family, and then they start giving or formation of mRNA, and then the results are. So the slow results but progressive results are there. Mutation in this androgen receptor can lead to incomplete sexual development or a disease known as Kennedy's disease, which is a spinal and bulbar muscle dystrophy. So the androgen receptor are the nuclear receptor family, slow in action but prolonged action. Also, this is estrogen receptor. Testosterone, I told you, that also converted to estrogen by the help of enzyme aromatase, and the cytochrome responsible for this conversion is cytochrome P19. So if this cytochrome P19 is deficient because of any disorder, genetic disorder, the estrogen will be reduced and there will be failure to fuse long bones. You know, estradiol, estrogen is responsible for the fusion of the bones. So in the male, it is also required, but since in the male, the predominant hormone is not estradiols, this is why the fusion occurs lately. The male have a long stature for the same reason. But if this is deficient, there will be more long stature or fusion will be decreased. This is a slide that actually indicating that the main hormone that is going into the cell or DNA level is dihydrotestosterone. So 90% of the dihydrotestosterone is responsible for the activity. 10% of the testosterone is also can move to this inside cell and nucleus, but the active form that produces action into the cellular level or at the cellular level is dihydrotestosterone. If we talk about the pharmacokinetics of these androgens, I told you that they have a high first pass metabolism, so they are not suitable candidate for oral intake. This is why we use intramuscular injection or synthetic preparation or any other than the oral. If it is purely testosterone, otherwise modified form of testosterone can be used also orally. Transport, we already discussed that 98% is it binds to sex hormone binding globulin. So this is the main transport. Liver is the main metabolizing energy where it is metabolized, and it is eliminated through the urine after conjugation. Small quantity of estrogen also produced from testes. This is I'm telling you again. In the male, a small quantity of estrogen is also present because of this conversion of testosterone. The active metabolite of testosterone is dihydrotestosterone, DHT. This is a metabolite from 5-alpha reductase, and we have the estradiol. These are the two active metabolites, whereas the inactive metabolite, we have endosterone and ethiocolenolone. So they are the inactive. The important part is dihydrotestosterone. This is the main. Estradiol is present, but in a small quantity. Now we come mainly with our pharmacology. What testosterone preparations we have? Okay, if naturally body is not producing testosterone, and we find out this should be diagnosed properly. It's not because of symptom. The testosterone level should be diagnosed, and then the therapy should be. Hormonal therapy should not start it with only histories and this. You have to diagnose this properly, because the hormonal therapy is, if it is not appropriate, then it is dangerous to the patient or to the person. Testosterone preparation, we have aqueous suspension. This is simply testosterone form. Then we have the esters of this testosterone. We have testopropionate or testosterone propionate. We have phenylpropionate, cypionate, enantioate. This is something you have to memorize, that we have the esters of the testosterone. And the dosing is not much important that how do you give, but it is giving weekly. Okay, so you have aqueous suspension testosterone, you have the esters, then you have oral. I told you that orally they are not much effective, but if testosterone is purely in its form, then it has a high first pass metabolism. But if it is converted to methyl form or floxy form, these are actually the derivatives. So they can be taken as oral as a tablet form. Then we have the transdermal patches or implants. They can be also given. So you have different preparation of testosterone, and you can use it depending if there is any deficiency of this hormone into the body. What is the therapeutic use of androgen or mainly the testosterone? They are given in a therapy known as androgen replacement therapy. Okay, what is this androgen replacement therapy? When we find out that there is androgen deficiency into the body, how do you find out? You get a clinical diagnosis from the hormonal levels, and you see that the patient have high LH but low testosterone. This is known as underlying testicular disorder. Or if you have a low LH as well as low testosterone, means this pituitary gland is also involved. So any of this androgen deficiency, when we find it out, because androgen is, or testosterone is more important for the growth, for secondary sex characters. So if we find out in the childhood period, then we give it androgen replacement therapy. Usually we use the derivatives of testosterone rather than synthetic, and the goal of this therapy is to make normalize the testosterone concentration into the body. So we keep monitoring the serum concentration of this hormone. This is actually required for different conditions, this is not for the life-threatening, but this can be used for delayed puberty or infertility. Also, we use this therapy for the lifetime because if the body is not producing this androgen. Okay, then we have other kind of, for example, the first thing is this androgen replacement therapy. The second condition where we use is hypopituitarism, where we find it out that we can use this androgen. We can use AIDS-related muscle wasting. So we have the HIV infections when we find it out the patient is, because testosterone can enhance the muscle mass. So the right use of this to give patients who have a very debilitated condition or muscle wasting, in this condition you can use this level. Hereditary angioneuritic edema, this is also a condition where you use methyl testosterone. Aging can be used, but they are not commonly used because the low level of this testosterone links to the aging, so aging can be reversed by using this. The misuse, misuse of this is important also. Many of the practitioners or the practitioner quacks, they use for infertility or impotence, which is there is no use, or this is basically it's not helpful for the in case of infertility or impotence. So this is a misuse. The right use is the androgen replacement therapy, hypopituitarism, muscle wasting like condition like HIV, and then we have the aging or hereditary angioneuritic edema. What could be the side effect if you use androgen or if you use for the prolonged time? If, for example, androgen is also given in estrogen-dependent mammary carcinoma. This is the rare use, but it can be used. So it may cause virilization of the male characteristic in the female, or the growth, hair growth, and other part and other things. So this could be for the prolonged thought if it is given for the prolonged. Polycystic jaundice. Okay, this is a condition can also happen. Polycystic jaundice is basically why? Because the chemical structure of this testosterone is more like a hormonal or 7 alkali. So this is why the things are important. Why we are discussing the chemical structure? You can ask why we need to know about the chemical structure of a drug. But no, this is important because you come across many conditions where you can have a gas. So cholestatic jaundice is basically because this 17 alkyl substitute group. So this sort of steroidal nature can also result in this jaundice condition. The other side effects are priapism, edema, precocious puberty, gynecomastia. This could be the problem with this androgen side effects. Anabolic steroid. Okay. The anabolic nature of this androgen, this can be used as a tool in different conditions. For example, athletes can use, but again, it's not a legal use because in sports, this therapy or anabolic therapy, if it is you come across many of these sports players that are using anabolic steroids or androgen, which is not legal because you are actually taking an ad from the outside, so that's not natural. So what are anabolic steroids? They are androgens, they are synthetic androgen, but they have a higher anabolic activity rather than, and they have a low androgenic or activity. Means they more act on muscles. I told you that the androgen action is on reproductive organs, muscles, brain, kidney. So they are synthesized in such a way, they have a chemical modification that they more work on muscle mass and they increase this muscle mass in the person. So androgenic or the sexual characters, they are not influenced, but they have a more anabolic activity, the anabolism or the higher growth rate of the cells. So this can be used as a tool to enhance the muscle mass in the The examples of these drugs are nandrolone propionate, nandrolone decanoate, stanozolone. So you just remember the name of this drug because they can be asked. So they are the anabolic steroid used as a higher anabolic action rather than the androgenic action. Anabolic steroid also can be used in catabolic states like acute illness, severe trauma. This is a legal use. You can use when you find out that the patient muscle mass is much wasting HIV as well. So acute illness, severe trauma, major surgery, renal efficiency insufficiency, because we told you that they also affects on renal organs or renal tissues. Osteoporosis, which is the bone mass, suboptimal growth in boys, anemia, performance. So these are the right use of this anabolic steroids. Okay, so second part, I told you a brief about anabolic steroid. The activity used in sports is not legal, but many of these people are using. We have a test known as dope test. I couldn't find out the full form of what is dope, but dope test is usually given, which actually identifies that whether you have taken any of these anabolic steroids. More important regarding androgens, because androgens are basically a natural part of the body, so they are mainly released. If there is deficiency, we can give, but more clinically important drugs related to the androgens are anti-androgens, okay, because they can be used in different cancer especially. So they can use another condition where we use anti-androgens. Anti-androgens, we'll discuss 4 of these drugs. One is known as danazol, the other is flutamide, finasteride, cyproterone, acetate. So we'll discuss one by one. For example, danazol. Danazol is anti-androgen. This is an ethisterone derivative, and it is effective orally. It's a weak. It has a weak androgenic as well as anabolic activity. But the main action of this danazol is basically, and it is also known as attenuated androgen or weak androgen. But the important part of this drug action is the suppression of gonadotropin releasing hormone or GN related FSH and LH release. So they actually act on pituitary gland, and this drug basically inhibits the function, the secretion of FSH and LH. And you know, once LH is decreased, luteinizing hormone is decreased, the testosterone function is also reduced. So FSH and LH, both of these release can be inhibited in male and female. So FSH is also important because of follicular stimulating hormone and luteinizing hormone. So inhibition in testicular and ovarian function is there. Danazol is used mainly in the endometrial atrophy, or it results in endometrial hyperplasia. So it results in endometrial, so it reduces the growth of the endometrium. So many conditions in the female is endometrial hyperplasia. Dose is 500, 200 milligram tablet because it is effectively orally. And so these danazol tablets are given in the endometrial hyperplasia condition. This is the use endometriosis, menorrhagia, fibrocystic breast disease, hereditary and genetic edema, gynecomastia, infertility. But this is mainly because of the endometriosis. There is hyperplasia of the endometrium, so you can reduce using this danazol. It affects mainly on gonadotropin releasing hormone, LH and FSH. Side effect could be amenorrhea, or you could have hirsutism, weight gain, hot flashes. This could be few side effects of this danazol. So first drug is danazol, not affecting directly on androgens, but rather than it affects on gonadotropin releasing hormone, FSH and LH, and mainly used in the female because of for the endometriosis. The second drug is flutamide. Flutamide is a non-steroidal, non-hormonal activity, and it is a specific anti-androgen. The active metabolite of this drug is 2-hydroxyflutamide, and it is a competitive blocker at androgenic receptor. So this is the main androgen blocker or anti-androgen drug that affects at this receptor level and competitive block the androgenic receptor. Where we use in the CA prostate or cancer of the prostate, and along with the GnRH agonist, the gonadotropin releasing hormone agonist, and the female hirsutism. So CA prostate, we use this flutamide, a drug that affects on, because prostate hypertrophy is related with the level of this testosterone or androgen. So if prostate is hypertrophied or it has a cancerous changes, you can stop this by using by inhibiting this androgen anti-androgen drug. So CA prostate flutamide target is androgenic receptor. The first one, danazol, we have a target on gonadotropin, FSH and LH. This target is on receptor, and the active form is 2-hydroxyflutamide, which is a competitive blocker at androgenic receptor. Another drug we have finasteride. Finasteride is basically, this is a competitive inhibitor of 5-alpha reductase. So this basically affects on 5-alpha reductase enzyme, and you know 5-alpha reductase is responsible for conversion of testosterone into dihydrotestosterone, which is the active form. So once active form is not there, so 90% of the action has been masked, because 90% this goes intercellular. Even if testosterone is present in plasma, but it is not going intracellularly. So this is important that you stop the action of 5-alpha reductase rather than you affect on hormones directly on like on pituitary or hypothalamus or Leydig cells of the testosterone. You convert or you stop the action of the enzyme 5-alpha reductase, which basically convert the active form. So in this way, you can also stop the activity of androgen or testosterone. Clinically used in BPH, benign prostate hypertrophy, because once the testosterone is not working effectively, so it can reduce the hyperplasia of the prostate. In BPH, also It is used for the male baldness, because baldness is basically due to overactivity of the testosterone. Okay. Kinetics, which is effective orally, metabolized in the liver, and the side effect could be loss of libido, impotence, decreased ejaculation. The dose is 5 milligram for benign hyperplasia or BPH. I should write it BPH, BH, not BHP. So mistake, BPH. And 1 milligram protein baldness. So this could be H2 clinical use. The last drug we have is the Cyproterone acetate, and this drug has a progesterone-like activity, and it basically inhibits LH. Once LH is inhibited, luteinizing hormone, what would happen? That there will be slow release of the testosterone, and also there will be slow action of this testosterone. Competes with dihydrotestosterone for also it competes at the cellular level, and it competes with the dihydrotestosterone. So LH also inhibited, and it also compete at the receptor level and with the dihydrotestosterone. So intercellular function also be reduced. The use is again the CA prostate and the male pattern baldness. The side effects of testosterone like hirsutism, virilizing syndrome, precocious puberty, and other things. So important drugs. Remember, we have the anti-androgen. We have the danazol, we have the flutamide, we have the finasteride, and then we have the cyproterone. They are the anti-androgen. You must keep in mind. Then you have the anabolic steroids like nandrolone. They are stanozolol. They are basically anabolic steroid, can be used. They have some right use, some other illegal use. And then the pure testosterone form is aqueous suspension esters. So I'm just reminding you the name of the drug because they are the main part. Always when we start asking any viva and any question, talk about the names of the drug, which you mostly forget. So you have to memorize the different preparations. Okay, so this is about the pharmacology of the male or the androgens. Now session is open for taking any sort of question if you want. If I go for the chat, you can go. Always I see later. Can you speak a bit louder? I was speaking very loudly. So hopefully, I was expecting that you might have listened. Okay, we have a question. What are the side effects of cyproterone acetate? The side effects of these drugs are basically you can have the reduced function of this. If you are giving in case of male, the reduce the impotence and the still. Okay, the male menstruation can be there. There will be increased growth of the hairs as well. So they are the few side effects, general side effects that we give because we come this. I just started on hot flushes, acne, and other things. The general is affecting side effects. Use of androgen basically androgen when you have hyperpituitarism, you are not deficiency of luteinizing hormone or the other FSH. So certainly hyperpituitarism, the main function of this LH in the male is to release the testosterone. So you have to give this testosterone externally. So androgens used in hypopituitarism in order to have the male sexual development of the male sexual character, also the spermatogenesis. So androgens are used in case of hypopituitarism when LH and FSH are affected.